What happens to your brain when you hum for 60 seconds? Hum right now. Close your mouth. Pick any note and hold it for 10 seconds. Feel where the vibration goes. Not in your throat, further. Into the bones of your face, behind your cheeks, above your eyes, deep into the back of your skull. That is not your imagination. That is bone-conducting sound at 3,000 meters per second through the solid architecture of your skull. 9 times faster than sound travels through air, and it is entering a set of chambers that most people do not know they have. Those chambers are doing something with that vibration, something measurable, something with a direct line to your cardiovascular system, your nervous system, and possibly the fluids surrounding your brain. Before we go further, notice something. You just hummed. You did not need instructions. You did not need training. You did not need equipment. You closed your mouth and produced a vibration that is, at this moment, propagating through your skull at the speed of sound, through bone. Whatever happens next happens inside a structure most people associate only with sinus infections. What it actually is will require us to go through the anatomy, the physics, the molecular biology, and the neuroscience one layer at a time. In the next 35 minutes, you will understand exactly what is happening inside that bone. And by the end, what you thought was a simple hum will look like something else entirely. Your skull's hidden chambers. Your skull is not solid. It contains 4 pairs of air-filled cavities, hollowed directly into the bone of your face and forehead. The paranasal sinuses. Most people know sinuses exist because they get infected. That association has completely obscured what these structures actually are. They are not drainage passages. They are not passive voids in the bone. They are resonance chambers, bony cavities with precise volumes, specific geometries, and resonant frequencies tuned by the physics of the air column they contain. The maxillary sinuses sit behind your cheeks, the largest pair. When you hummed 10 seconds ago, the vibration you felt behind your cheekbones was these cavities responding. The frontal sinuses sit behind your forehead, the vibration above your eyebrows. The ethmoid sinuses cluster between your eyes, small and numerous. The sphenoid sinuses sit deepest of all, behind the ethmoids, so deep that their resonance arrives not as a surface sensation, but as a vibration at the center of your skull. Each pair is a separate air-filled cavity lined with ciliated mucous membrane. Each connects to the nasal passage through a narrow opening called the ostium. The dimensions of that opening matter more than the size of the cavity itself, because the ostium controls everything that comes next. Here is what nobody tells you about these chambers. They are producing a molecule right now, continuously, whether you hum or not. A molecule that dilates blood vessels. A molecule that the pharmaceutical industry spends billions of dollars manufacturing and delivering through hospital equipment. Your sinuses are making it inside your skull. The question is how much of it reaches your lungs. And the answer to that question changes completely when you hum. The physics of sinus resonance. When an external vibration matches the resonant frequency of a cavity, the air inside oscillates at maximum amplitude. This is acoustic resonance. It is the same physics that makes a wine glass sing when you run a wet finger around its rim. The same physics that makes a pipe organ produce sound from air flowing through tubes of specific length. Your sinuses are Helmholtz resonators, chambers with narrow necks that amplify specific frequencies. When you hum, the vocal cords produce a fundamental frequency somewhere between 100 and 400 hertz. That vibration propagates through the laryngeal cartilage, through the hyoid bone, through the mandible, through the temporal bone, and into the cranial vault. Your skull becomes a vibrating shell. The sinuses inside it resonate. The oscillating air pressure inside the sinuses during humming is measurably higher than during quiet breathing, during speech, or during any other vocal activity. The reason is specificity. Speech changes frequency with every syllable. Singing changes pitch with every note. Humming holds one frequency and holds it continuously. It is the only vocal activity that maintains a single resonant input long enough for the sinus cavities to reach full amplitude. The sinuses respond to humming because humming is the only thing the body does that is acoustically suited to driving them. Not all frequencies produce equal resonance. The maxillary sinuses, the largest pair, resonate at approximately 200 to 350 Hz, depending on individual anatomy. The fundamental frequency of a male hum typically falls between 100 and 200 Hz. Female between 200 and 400. Female humming frequencies naturally fall closer to maxillary sinus resonance. This may explain why some studies report greater nasal nitric oxide output in female subjects. The anatomy creates a closer match between vocal frequency and sinus resonance frequency. For maximum resonance coupling, the optimal pitch is a comfortable mid-range note, not the lowest note you can produce, that may fall below sinus resonance, not the highest, that may exceed it. The note most people naturally produce when humming without thinking about pitch tends to fall precisely in the range the maxillary sinuses are tuned to respond to. Whether this is coincidence, anatomical correlation, or unconscious selection by the body for maximum resonance coupling has not been formally studied. You do not need to find the right note. The note that feels most natural, that requires the least effort, that sustains with the least strain. That note is likely close to the frequency your sinuses are built for. Maniscalco and colleagues, publishing in the European Respiratory Journal, confirmed that the frequency and amplitude of humming correlated directly with nasal nitric oxide output. Louder humming and frequencies closer to sinus resonance produced higher levels. The physics favors a relaxed, sustained mid-range hum, the kind you produce absent-mindedly while cooking, while walking, while sitting in a quiet room. The absence of effort is not laziness. It is resonance. The body finding the frequency that couples most efficiently with the bony chambers in its own skull. But the note is only the delivery mechanism. What matters is what the resonance produces. The nitric oxide mechanism. The mucosal lining of every sinus cavity continuously produces nitric oxide through constitutive nitric oxide synthase. The production is constant. It does not require a stimulus to begin. The sinuses are running this biochemical process right now, regardless of what you're doing. During quiet breathing, the nitric oxide produced in the sinuses diffuses slowly through the ostia into the nasal airway and is inhaled in small quantities with each breath. The delivery is limited by physics. The ostium is narrow. Passive diffusion through a narrow opening is slow. Most of the nitric oxide produced in the sinuses sits in the cavity, accumulating, because the passage connecting it to the airway is too restricted for efficient transfer. Your sinuses are running a continuous production line for a cardiovascular molecule. Most of it never reaches your lungs. It builds up in the chamber, waiting for something to move it. Humming is that something. When the sinuses resonate, the oscillating air pressure inside them creates a mechanical pumping effect. Each pressure oscillation during humming flushes nitric oxide-enriched air out of the sinus, through the ostium, and draws fresh air in. The molecule that diffuses slowly through a narrow opening under quiet breathing is pumped out actively with each vibration cycle. The sinus is the production chamber. Humming is the pump. The ostium is the valve. The vibration frequency determines the pumping rate. This has a secondary implication worth noting. Nitric oxide is antimicrobial. It inhibits bacterial and fungal growth in the sinus cavities. The nitric oxide that accumulates in the sinuses during quiet breathing maintains a baseline antimicrobial environment. Humming, by flushing the accumulated gas and stimulating fresh production cycles, ventilates the sinus cavities more actively. Studies of humming in patients with chronic sinusitis have shown improved sinus ventilation and reduced infection frequency. The sinus that is regularly vibrated is regularly flushed with antimicrobial gas and less likely to develop the stagnant environment in which infection establishes itself. But the cardiovascular implication is what makes this extraordinary. The 15-fold increase. Weitzberg and Lundberg at the Karolinska Institute measured nasal nitric oxide output during humming versus quiet breathing and found a 15-fold increase, from approximately 0.2 to 3 parts per million in exhaled nasal air. 15-fold. Not a percentage increase, not a doubling, a multiplication by 15. A magnitude increase that would be considered extraordinary for any single intervention in the clinical literature. And the mechanism is purely acoustic. No drug, no device, no specialized delivery. Oscillating air pressure during humming dramatically increases the gas exchange rate between the sinus cavity and the nasal airway. The nitric oxide that accumulated slowly during quiet breathing is pumped out actively with each vibration cycle. 15-fold is not a pharmacological dose. It is a mechanical amplification. The sinus producing nitric oxide at its normal biological rate. Humming delivering it to the airway 15 times faster than quiet breathing allows. Now consider what happens to that gas once it enters the nasal airway. You inhale it with your next breath. The nitric oxide-enriched air travels down the trachea and into the lungs. At the alveolar membrane, the thin barrier where gas exchange occurs between air and blood, the nitric oxide crosses into the pulmonary capillary blood. Once in the blood, nitric oxide activates soluble guanylate cyclase in vascular smooth muscle cells. This increases intracellular cyclic GMP, which relaxes the smooth muscle and dilates the pulmonary vasculature. This is the identical molecular mechanism of sildenafil, the pharmaceutical vasodilator that generates billions in annual revenue. The molecular pathway is not similar, it is identical. One enzyme, one second messenger, one smooth muscle response, one vasodilatory outcome. Indistinguishable at the molecular level. Pause on that for a moment. The pharmaceutical industry identified this molecular pathway, understood that nitric oxide was the key signal, and built an entire delivery industry around getting the molecule into the pulmonary vasculature. That industry exists because the delivery problem is genuinely hard. Nitric oxide is unstable. It reacts with hemoglobin and is inactivated within seconds in the bloodstream. Delivering it at therapeutic concentrations to the pulmonary capillaries requires specialized equipment, precise flow control, and continuous monitoring. Your sinuses solved the delivery problem differently. They positioned the production chambers directly adjacent to the airway. The molecule does not need to survive long in the bloodstream. It is produced next to the lungs and inhaled fresh with each breath. The architecture is elegant in a way that becomes obvious only when you understand what it is doing. Your sinuses are manufacturing the molecule. Humming is delivering it to your lungs through acoustic pumping of bony resonance chambers in your skull. Pulmonary vasodilation has a measurable downstream consequence you can understand through the physics of gas exchange. Oxygen crosses the alveolar membrane into the blood by diffusion. The rate of that diffusion depends on the surface area of the membrane in contact with blood. When pulmonary capillaries dilate, more capillary surface area comes into contact with the alveolar membrane. More surface area means more diffusion area. More diffusion area means more oxygen transfer per breath. Each hum cycle that pumps nitric oxide from the sinuses into the lungs produces a brief period of enhanced pulmonary vasodilation and improved oxygen transfer efficiency. The effect is mild. This is not supplemental oxygen. It is not a bronchodilator. It is a modest increase in the efficiency of a gas exchange system that was already operating. But it is measurable. And it occurs with every hum. If you have ever noticed that a period of humming, absent-mindedly while cooking, while walking, while sitting quietly, left you feeling slightly clearer, slightly more alert, slightly more present, that is not placebo. It is not imagination. It is enhanced oxygen transfer. Your lungs just operated at marginally higher efficiency because your sinuses delivered a vasodilator that the humming pumped out of bony cavities in your skull. The clarity you may have attributed to the meditative quality of humming was partly vascular. But the nitric oxide mechanism is only the first pathway, because the vibration that resonates the sinuses is simultaneously propagating through every bone in your skull, and it is reaching structures that no external sound can touch. Vagus nerve and bone conduction. When you hum, the vocal cords vibrate the laryngeal cartilage, which transmits vibration through the hyoid bone, through the mandible, through the temporal bone, and into the entire cranial vault. This is bone conduction, mechanical vibration propagating through solid structures at 3,000 to 4,000 meters per second, far faster than through air. Your skull becomes a vibrating shell, and every structure inside it receives the vibration simultaneously through the bone. Your inner ear detects bone-conducted vibration through the cochlea. This is why you hear your own hum as louder and deeper than anyone else hears it. The bone pathway delivers low-frequency vibration directly to the cochlea, bypassing the air pathway that attenuates low frequencies. The vibration your inner ear receives during humming is qualitatively different from any external sound. It is full spectrum, bone-conducted, and continuous. The vestibular organs adjacent to the cochlea also receive this vibration. Whether this produces the subjective groundedness that many people report during sustained humming has not been formally measured. The connection is anatomically plausible, but not confirmed. The vestibular system is receiving a continuous, predictable low-frequency input. Whether it interprets that input as a stability signal, producing the settled, grounded quality humming often carries, remains an inference from anatomy, not a measured finding. But the inference is not unreasonable given the anatomy. The bone conduction pathway also means the vibration reaches the vagus nerve, not only through the tissue surrounding the larynx, but through the temporal bone adjacent to the nerve's intracranial course. The vagus receives the vibration from two directions simultaneously, locally at the larynx and remotely through the skull. That dual delivery is unique to humming. External sounds do not produce it. Speech does not sustain it. Singing interrupts it with every consonant, every breath, every pitch change. Only humming delivers continuous bone-conducted vibration to the vagus through both pathways for the full duration of the note. Consider what that means for the nerve. The vagus nerve is the 10th cranial nerve. It is the primary highway of the parasympathetic nervous system, the branch responsible for rest, repair, digestion, and the physiological state the body requires for recovery. It carries signals in both directions. Afferent fibers carry information from the organs up to the brain. Efferent fibers carry commands from the brain back down to the heart, lungs, and gut. The vagus nerve passes directly alongside the larynx, separated from the vibrating vocal cords by millimeters of tissue. During humming, sustained vocal cord vibration mechanically stimulates the vagus through the surrounding tissue, not through a neural pathway, not through a reflex arc, but through direct mechanical vibration of the nerve itself. The nerve is physically shaking at the frequency of the hum, and the shaking activates its afferent fibers the way any mechanical stimulus activates a nerve, through mechanosensitive ion channels in the nerve membrane that open in response to physical deformation. If you were wearing a heart rate monitor while humming, you would see the effect within 15 to 20 seconds. Heart rate drops, not dramatically, typically 2 to 5 beats per minute, and heart rate variability increases. The vagal activation is shifting the autonomic balance toward parasympathetic dominance. You would feel it as a subtle settling, a sense of the chest opening, the shoulders dropping slightly, the jaw releasing tension you did not realize you were holding. The feeling arrives without effort because the mechanism does not require effort. The vibration stimulates the nerve. The nerve responds. The heart slows. No conscious regulation needed. This is a distinct pathway to vagal activation, separate from the baroreceptor feedback that slow breathing produces, separate from the trigeminal vagal reflex that cold water on the face triggers. Humming stimulates the vagus through direct mechanical contact at the anatomical site, where the nerve is most superficial and most exposed to laryngeal vibration. And humming produces a more sustained vagal stimulus than singing precisely because of its simplicity. Humming maintains continuous vocal cord vibration without the interruptions of articulation, the consonants, the breathing gaps, the pitch changes that singing requires. A person humming a single sustained note for 60 seconds delivers an unbroken mechanical stimulus to the vagus. 60 seconds of singing, with its vowel transitions and breathing pauses, produces an intermittent stimulus. Vibration, gap, vibration, gap. Humming eliminates the gaps. The simplicity is the advantage, but the vagal pathway is running simultaneously with a breathing mechanism that humming forces without any conscious control. The breathing ratio advantage. Humming can only occur during exhalation. Try to hum while breathing in. You cannot. The vocal cords require exhaled air flowing past them to vibrate. Inhaled air flows in the wrong direction. This is not a technique. It is physics. A natural hum cycle therefore produces an exhale to inhale ratio of approximately 3.1 to 4.1. The hum extends the exhale to 8 to 12 seconds, while the inhale remains 2 to 3 seconds. This ratio is the range that maximally shifts autonomic balance toward parasympathetic dominance. You do not need to count. You do not need to follow a protocol. The vocal cords enforce the ratio. The hum extends the exhale because the hum is the exhale. The inhale is brief because it is the pause between hums. The body takes what it needs and returns to the note. Extended exhalation activates the vagus through a second independent pathway, the baroreceptor reflex. Your aortic arch and carotid sinus detect the slight blood pressure changes during extended exhalation and trigger vagal output to slow the heart. This is the mechanism behind every clinical breathing protocol in use today. Box breathing, 4-7-8 breathing, coherence breathing. Every one of them is trying to achieve the exhale-dominant ratio that humming produces automatically as a physical consequence of how the vocal cords work. Those protocols require training. They require counting. They require sustained attention to maintain the ratio. They require weeks of practice before the pattern becomes habitual. Humming requires nothing but a closed mouth and a note. A person who hums for 60 seconds is performing, without instruction, without counting, without training, the breathing pattern that the clinical literature identifies as optimal for parasympathetic activation. Dual vagal pathways. Two vagal pathways operating simultaneously. Direct mechanical vibration of the nerve and baroreceptor-mediated exhale activation. Together, they produce a combined parasympathetic shift that neither pathway produces alone. The person who hums for 60 seconds is receiving vagal stimulation through two independent mechanisms running in parallel. Heart rate decreases. Heart rate variability increases. The autonomic nervous system shifts from sympathetic to parasympathetic dominance, not because the person decided to relax, but because the physics of a vibrating vocal cord and a closed mouth produce the neural and respiratory inputs that the autonomic system interprets as safety. The dual pathway matters because each one alone has limitations. Mechanical vagal stimulation without the breathing ratio produces a more modest autonomic shift. The nerve is vibrating, but the baroreceptor pathway is not contributing. Extended exhale without the mechanical vibration produces a gradual shift. Effective, but slow, requiring sustained attention to maintain the ratio. Humming activates both simultaneously through a single action. The vibration is automatic. The breathing ratio is automatic. Neither requires conscious maintenance. The person hums, both pathways fire, and the autonomic shift is the sum of two independent inputs, arriving through two independent neural routes. Consider the person who has been told to practice relaxation techniques, who has tried meditation and found it difficult, who has attempted breathing exercises and lost count, who feels that just relax is advice without a mechanism. Consider also the person with a heart rate variability score that has been declining for years, who understands the data, who has read the research connecting low heart rate variability to cardiovascular risk, to impaired stress recovery, to poor sleep architecture, but has not found an intervention that fits into an actual life, not a 20-minute practice requiring silence and a dedicated space, not a wearable that provides biofeedback, but no clear action, something that works in the 90 seconds between tasks, in the 2 minutes before a difficult conversation, in the 10 seconds at a red light. Both of those people have a 60-second intervention that produces measurable autonomic shift through physics rather than psychology. The hum does not require the person to feel calm. It produces calm as a physiological consequence of two vagal pathways activating simultaneously. The calm arrives whether the person believes it will or not. The nerve does not require belief. It requires vibration. But there is a fifth layer, one that reaches deeper into the skull than either of the pathways described so far. And it is the layer the research is only beginning to map. CSF oscillation and brain clearance. During humming, the closed glottis and sustained exhalation produce a slight elevation in intrathoracic pressure. The pressure inside the chest cavity increases because air is being pushed against a partially closed valve. This pressure increase transmits through the venous system to the intracranial space through a direct hydraulic connection, through the internal jugular veins and the dural venous sinuses. The veins connecting your chest to your skull are open tubes. Pressure changes in the chest propagate to pressure changes in the skull within a single cardiac cycle. The result is a gentle rhythmic oscillation of intracranial pressure synchronized with the humming frequency. A pulsation that quiet breathing produces at a lower amplitude, and that humming amplifies through the added resistance of the closed glottis. Cerebrospinal fluid, the fluid that surrounds and cushions the brain, that fills the ventricles, that circulates through the subarachnoid space, oscillates in response to these pressure changes. The fluid is not static. It moves with every heartbeat, with every breath, with every change in intrathoracic pressure. Dreha Kulikovska and colleagues demonstrated that respiratory-driven cerebrospinal fluid flow is a significant component of overall cerebrospinal fluid dynamics. Humming amplifies the respiratory pressure component through the added airway resistance of the closed glottis, producing larger, more rhythmic cerebrospinal fluid oscillations than quiet breathing generates. The glymphatic system, the brain's waste clearance pathway, depends on cerebrospinal fluid movement through the perivascular spaces of the brain. Cerebrospinal fluid flowing along perivascular channels collects metabolic waste, including amyloid beta, and drains through perivenous pathways. Any intervention that increases cerebrospinal fluid pulsatility, that moves the fluid more actively through these channels, potentially enhances the clearance of metabolic waste. Humming, by driving rhythmic intracranial pressure oscillations through the mechanics of a closed glottis and sustained exhalation, may contribute to this pulsatility. This brings us to the layer of the analysis where the evidence requires careful handling. Evidence calibration. The 5 mechanisms described here sit at different levels of certainty. Honesty requires transparency about which shelf each one occupies. The nitric oxide data is strong. Weitzberg and Lundberg measured it directly. The 15-fold increase has been replicated. The mechanism is understood at the molecular level. The vagal data is established. Mechanical vibration of the nerve is documented. The autonomic shift is measurable in real time with standard equipment. The breathing ratio is physics. The exhale to inhale ratio is a consequence of vocal cord mechanics. It is not a hypothesis to be tested. It is a physical constraint that produces the ratio as a direct outcome. The cerebrospinal fluid oscillation is the most preliminary layer. Intracranial pressure changes from respiratory mechanics are documented. That humming amplifies these changes through added glottal resistance is physically consistent. That the amplified cerebrospinal fluid pulsatility enhances glymphatic clearance during a 60-second hum has not been directly measured. The physics supports the connection. The direct evidence does not yet exist. The viewer should know which shelf each mechanism sits on. The cerebrospinal fluid mechanism sits on a different shelf than the nitric oxide data. That distinction matters. 5 mechanisms operating simultaneously from a single closed-mouth vibration, each at a different level of evidence, the strongest replicated and measured, the most speculative supported by physics, but not yet confirmed. This is the convergence that cannot be walked past in the bioacoustics literature, because it means a 60-second hum is not a relaxation technique. It is not meditation. It is not a breathing exercise. It is a multi-system intervention that the physics of acoustic resonance, bone conduction, and respiratory mechanics produce, and that the existing evidence partially, but not fully confirms. The confirmed mechanisms alone, sinus nitric oxide production, vagal stimulation, exhale-dominant breathing ratio, would justify the 60 seconds. The preliminary mechanisms may eventually extend the justification further. The physics supports all 5. The evidence confirms 3. Hold that distinction. 60 seconds, the full picture. The pharmaceutical industry has spent billions developing inhaled nitric oxide delivery systems for pulmonary vasodilation. Systems that require compressed gas cylinders, precision flow regulators, specialized delivery masks, continuous monitoring equipment, and hospital settings with trained respiratory therapists. Your skull already contains the delivery system. 4 pairs of production chambers connected to the airway through narrow ostia, producing the molecule continuously, waiting for the acoustic pump that flushes it into the lungs. The pump is a hum. The delivery system is the sinus architecture you were born with. The molecule is the one the hospital charges thousands of dollars per treatment to deliver through industrial equipment. 60 seconds of humming delivers it at your kitchen table, not at pharmaceutical concentrations. The dose from humming is mild. The vasodilatory effect is modest. Nobody is suggesting that humming replaces medical nitric oxide therapy for the critical conditions that require it. Neonatal pulmonary hypertension, acute respiratory distress syndrome, conditions where the dose must be precise and the delivery must be continuous. Humming is not that. Humming is the low-dose, self-administered, daily accessible version of a molecular pathway that the body already possesses. The mechanism is identical. The dose is different. The accessibility is incomparable. The pharmaceutical version requires a hospital. The biological version requires closing your mouth. What you felt when you hummed at the start of this video, the vibration in the face, the resonance behind the cheeks and forehead, the sense of something shifting in the skull, was the activation of bony resonance chambers pumping a vasodilator into your airway. The mechanical stimulation of a cranial nerve running alongside your vocal cords. An exhale-dominant breathing ratio your vocal cords enforce without instruction, and a gentle oscillation of the fluids surrounding your brain, driven by the pressure mechanics of a closed glottis. 4 confirmed mechanisms running simultaneously. 1 speculative mechanism consistent with the physics. 1 note. The mechanisms were running before you knew their names. They will run again tonight if you hum before sleep. Sitting on the edge of the bed, eyes closed, 1 sustained note. The length of a normal exhale. Close your mouth. Pick a note. 60 seconds. The skull does the rest.